With the recent occurrence of Typhoon Haiyan, the 24th storm to batter the Philippines this year and the strongest in the world to date, total destruction. Villages were flattened to the ground and more than 4,000 people were killed. This calls for the Philippines to intensify its efforts in terms of disaster preparedness and rehabilitation. In relation to the recent catastrophe that struck the Philippines, we came up with the green architecture schools that are designed to be disaster resilient. This school will serve as learning centers in the weekdays and training centers for adults during weekends. It makes use of recycling and energy-saving practices. In the event of natural calamities, the green architecture schools will serve as evacuation centers. It provides the necessary requirements by health workers, educators, and rescue personnel during times of emergencies. This project is also a platform for ownership and co-ownership, as the community members can be mobilized as workers in the construction of the building.
Education is important for building human capital of the country. And with our idea of green architecture schools and use of advanced technology, we will provide students with eco-friendly learning environment and up-to-date information about worldwide trends in various sectors, which will enable their curiosity, creativity, and will lead them towards their own innovations. As we know, the public schools in disaster-struck areas are destroyed, and the basic education to children has been disrupted. The Green Architecture School is perfect for children's education because it's designed to be disaster resistant, has recycling and energy-saving practices, and has reliable communication technology. Another benefit of putting the Green Architecture School is that it can serve not only children but also the community. During the week, it will be used as a venue for providing basic education. And in the evenings and weekends, it can be served as a venue for trainings and awareness campaigns related to healthcare, disaster preparedness, and livelihood topics, which will keep the whole community up to date with global innovations and trends in various sectors.
The new and improved infrastructure, able to withstand all hazards, should also be prepared for emergency health. It includes access to reliable, renewable energy and clean water supplies daily and adhere to the standards for evacuation center by the Department of Health, which includes breastfeeding provision and the protection of women, children, and persons with disability. It should also be able to provide health services, including vaccine provision, vitamin A supplementation, and basic medical care. It should also be able to do normal spontaneous delivery and minor surgeries within its medical center for logistics management. Both human and material resources shall be stored for leptospirosis prophylaxis, control of infectious diseases, including respiratory and gastrointestinal illnesses.
Being a member of the Special Action Force, I have had the personal experience of being involved in some of the deadliest disaster response operations in various areas of the country. I find the project very responsive and helpful for the effective and efficient performance of our disaster response efforts. So how does this project help? 1. Constant and reliable communication during disaster response operations is paramount so that timely and informed decisions and necessary interventions can be made if necessary. In line with this, the project will provide for a disaster response command center, which would be furnished with advanced satellite phones so that communication, monitoring, and coordination are ensured 24/7. 2. A major challenge during and after the onslaught of major disasters is when the delivery channels are cut, since it hampers the mandatory supply and resupply of disaster essential inputs such as rescue workers, rescue equipment, and relief items. This project answers the challenge through its built-in landing pads, which would be capable of accommodating rescue choppers so that air transportation would be possible at all times. 3. Rescue operatives also have their respective families and relatives to worry about before, during, and after disasters. The project can serve as a safe and conducive evacuation area where rescue operatives can bring their families and relatives before disaster strikes. In this way, they can fully concentrate and focus with their disaster response efforts without thinking of the safety of their family. 4. The project is designed to be easily converted from a school into a disaster-resilient and self-sustaining evacuation center. This aims to develop among the citizenry the behavior of adhering to preventive evacuation procedures so that the number of people to be rescued will be significantly lowered, thus making the job of the already limited number of rescue operatives easier.
With all the benefits that it brings to the sectors of health, education, and disaster response, we believe that this project can be the pathway towards a sustainable future. But this remains to be a dream without the support of the government, NGOs, the private sector, and of course the community.